even went like 1.5 miles today. But that's at the very
Saturday?
No, Saturday. What did I webinar. My name is Sherry Obrentz, and I'm an Associate Dean in the Office for Undergraduate Education, which is basically just academic affairs in Emory College. Today you have a treat in store for you. We have a panel of experts who are going to walk you through FERPA, the Family and Education Rights and Protection Act. Close enough?
Close enough.
Something like that. Emily will help us out. The HIPPA regulations, and also guest access in OPUS. My partner for these series for the next two as well is Bridget Guernsey Reardon, who is our Vice President in Campus Life.
Assistant Vice President, but you can give me that promotion
yes,
today. That's kind of fun.
Wonderful. Family and parent programs as well. So you'll see Bridget a lot throughout the summer. And once you are officially members of the Emory community in the fall, once your students start, lots of great information comes out from her website, her office throughout the entire academic year. So
Great.
You want to give a little?
Welcome everybody. I've seen some of you through webinars and Facebook Lives that we've done through the Office of Family and Parent Programs, but we're excited to partner with our academic folks and our colleagues here today to tell you a little bit more that might be helpful to you as you onboard your student.
All right, so we're going to let the panel introduce themselves, and we are going to jump right in. So.
Hi, my name is Emily Talent. I am the Senior Associate Director for Student Records for the Office for Undergraduate Education. Welcome.
Hi, I'm Elizabeth Barrett. I'm the Senior Account Rep in Student Financial Services. Welcome.
Welcome. I am Sharon Rabinovitz. I am your Assistant VP of Campus Life and the Executive Director of Student Health.
Wonderful. So what we're going to go through today, just a second, are a few things here. We just gave our welcome to Emory, so we're so glad that you and your students are going to be joining us this fall. We're going to go through FERPA. This really talks about the access you will have to your students' educational records and how you can gain access to that, and if you don't get access to that, what you're going to do as well. Next, we're going to talk about our OPUS guest accounts. OPUS is our main operating system where students do a lot of official business, including registering and what's important to you, paying the bills. So Elizabeth is going to talk a little bit about that and how to set up guest access. And finally, we're going to talk about HIPPA and immunization forms. We know that this changes a little bit from students in high school to college. Again, what you as parents and family members have access to, and really how you can help coach your students and teach them some things to get ready to come to college. So we're going to go ahead and jump right in.
All right. So I'm going to talk to you about FERPA. FERPA, you may have heard about when your child was in high school. It is the Family Educational Rights and Privacy Act. It was passed back in 1974, and it deals with student records and protecting the privacy of student records. When your child was in high school, those rights lay with you. Now that they are in college or going to be in college, those rights reside with the student, regardless of their age. FERPA gives students the right to inspect their records, so anytime they want to know what academic information is kept about them at the institution, they have a right to request and view that information. Students also can complete a letter of consent. This letter of consent is going to allow anyone that they name to have access to records. So big tenet of FERPA is that we're not going to release any information about a student, even to parents, without the student's written consent. Without the letter of consent, there are some things that you would have access to. There's basic information about your student. These are things that would not be harmful if released about a student. So whether or not they're enrolled, address and telephone number, even though those are things that we may release, we don't typically release unless we have your students' your students' consent to release that information. Academic information, we don't give out things like grades, but we can let you know if your student is enrolled, if they're full or part-time, if they're a freshman, sophomore, things like that. The dates of enrollment, if they've earned a degree, and what their major is. Other information that is accessible to you without that letter of consent would be if they've received any academic honors, or if they are participating in sports or any of those officially recognized activities. Those are all things that are free range to release, whether or not they have released that information through a letter of consent. So if we're going to get into grades and the things that are beyond those directory information pieces, that's where the letter of consent comes in. And your student can go online, and on the OUE website, they can find the letter of consent form. They'll do this later on when they come for orientation, correct?
It's actually on their summer checklist, so it's one of the things that is available and open to do today. And when Emily's done talking, we'll kind of go through the questions you can ask your students about whether or not they are willing to fill out that letter of consent, which we hope most of them are.
Right. So through that letter of consent, they can name individuals. It can be you as their parent. It can be anybody that they choose who they want to have given the college consent to release information about their academic progress. So this can be whether or not they're on academic probation. It can be just any sort of academic question that you have.
Would it be their class schedule? Could you see that?
Class schedule is...
That could be in the case of an emergency, something
Right.
they would want to know, right?
Exactly. So, and it is good to know about FERPA that in cases of emergency, when it's regarding the student's health or safety, FERPA is not our primary concern. Our primary concern is the student's safety. So FERPA kind of goes to the background in those sort of cases. Yeah.
I would say, though, consent is really, really important to talk about with your students before they come to campus, and start setting up some ground rules of, when will I see your grades? How
Right.
will I know how you're doing? How often can we check in? Ideally, you are not calling us asking about this. You're talking
Right.
with your students directly, but we know sometimes you're concerned about getting the full picture or all the information. And the only way that we can really release all of that information or the details that you're probably used to knowing about is if your student has filled out that consent form.
That's right. Our hands are tied.
Yeah. Same with probation. And so this comes up a lot where parents or family members might say, how will I know if my student's in trouble by mid-semester check or other ways? And you won't. We don't do mid-semester progress checks or grade checks. The official grades won't get posted until the end of December. And so that's the conversation to really be having with your students along the way. And if you feel like you're not getting that information, you're really worried about them, you can always call the Office for Undergraduate Education to see if we need to do an intervention and get some information a little bit earlier.
Right.
Yeah.
We can't always give you the information, but we can at least talk to your student and have them contact you.
And I will say, whenever a parent calls me, and that has happened a few times in the last 14 years, I usually say, I will reach out to your students and I'm going to tell them that you called. So hopefully we're not triangulating either, saying,
Right.
I'm not a helicopter parent, and by the way, don't tell my student that I called. That's not usually a productive or helpful conversation, because when we reach out to students saying, just checking in on you, they don't understand why. So having those open dialogues with parents, I don't know if you want to add
just
anything to that.
Just like Sherry mentioned, there'll be so many things that the students will talk to the parents about when they come. Doing it this summer will take care of it. We'll take care of that conversation because you'll also need to help them navigate everything else.
Right.
So.
And one more quick note about the letter of consent. Just for your information, a student has the right to change their mind.
Yeah.
So it's important to keep those conversations going if you're not hearing what you expect to hear.
And for the process of probation at the end of a summer, and very few of your students will end up on probation, so not something to worry about, but if a student is on probation and they have given consent, we will send a copy of the letter to the permanent address. So when we get to the OPUS records, that's something too that we want to make sure that your home address and your contact information is also up to date in OPUS so that we are actually communicating with the right people.
And Sherry, what is probation? What is the grade point that a person gets on probation in the college?
For the college, well, to make it easy, it's usually anything less than a 2.0. We have some other, a C average, yeah. We have some other more serious probations when students are earning a term of a less than 1.5. But a good, good kind of idea or baseline is if your students are at that 2.0 or above, either for term or cumulative, you're in pretty good shape. So C's get degrees, and we will stick by that as long as we go. But we know all of your students are going to do great here. All right. So we're going to move on to our OPUS Access, which will piggyback a little bit onto consent as well, because once your students fill out that consent form, the indicator actually lives in OPUS so that if you do call, we know who we have consent to speak with. But there will be a few more things that you'll get access to directly with your own login. So Elizabeth, we'll get you started with that.
Hi. One of the options students have when they have an OPUS account is set up Guest Access, and it's on your student financials tile in a drop-down box, and a student can add up to 5 guests. The guest can be anyone. It can be a parent, it could be a grandparent, it can be an employee of a parent. This gives them the access to go into OPUS and view certain things. If you'll see the list is online, there's a lot of options. The student actually sets up the guest access and calls it a name. It may say mom, dad, whatever they want to call it, and then they put their 7-digit student ID number in it. And then they create a password, and then they would give that to their guest. The one thing that you have to keep in mind is the student determines what that person can see. They can change it, they can delete it, they can give them access to make a payment online, and that's all. And sometimes they do that for if the boss is, if their father is a secretary wants to do something, then they let them have that guest access, because our office will not speak to the guest. We only speak to the student or the parent. They can give them access to look at their grades. They can give them access to view their addresses, to set up a bill pay or email address. This parent will have the student's ID number because it's part of their logon, and the student can change it anytime they want. So this is a list of numerous stuff, and they can pick everything, or they can pick one thing, or they can pick 10 things. It's up to the student to decide what each guest will have access to.
Yeah. So I will reiterate this, and you've said it very clearly, but this is really important because you will not set up guest access on your own. Your student actually needs to log into OPUS, create that guest access, and actually creates your login and your password as well. And so really important, this is probably one of the biggest changes, especially for other systems where you will get to choose your own login and password, that your student has 100% control over this. And like FERPA can change at any time who their guest access goes to and the levels of guest access as well.
And also the student has the only ability to do a lot of stuff, and one of the things that the student has, I'm adding this on there because it's important, is a bill pay or email address. They can set up one bill pay or email address. It doesn't have to be one of the guests. It can be whoever they want to get a copy of everything our office sends out to you, to the student. The student gets all the information from our office. So a bill payer, which is one of the electronic addresses that they can choose, would get the email saying there's a bill online, there's a payment due, you may missed a payment. So anything that the student wants, the student is actually determines who gets to see what and do what.
And we know this, I mean, we've gotten to the age too where we're all a little bit email blind. But you have to know that for any bill that's due or anything that's official, we are sending all official communications to the students' Emory email. Over the summer, it's still some of their home email addresses, but starting on that first day of school, it's to the Emory email only. And so we often get students who say, well, nobody told me, or I didn't get a notification. And we keep really good records of all of the notifications that's sent out. So we can even see, when the message was sent, when it was opened or not opened, down to the second. And so there's very few instances, I don't know ever, that a bill notification didn't go out. And so really having that conversation with your student about whether or not you're getting the copy or the duplicate email is really important. We know our students get really, really busy, and if they don't set that up ahead of time, it's pretty easy to miss a deadline on their own if it just looks like a notification. Great.
And I want to add to encourage your students to really read through the emails, because they do get somewhat overwhelmed. However, when they read through it, it all makes sense. A lot of people have already scoured it to make sure that it does. And if there's a question, there's usually a response that you can make, or a question that you can ask to somebody about what is in the email. So please encourage them to read it thoroughly.
So how you're going to get access to OPUS, this next slide addresses that. Your student's going to log into OPUS.
Right.
On that financial tile, they're going to click on the Create Guest Accounts, and then follow the steps to do it. It's pretty intuitive and easy. You can kind of watch over their shoulders if you want to see them set that up as well. Just know that they can change it after the fact. So those are some of the funny stories when students create your own username or nicknames as well. So very
and it's up
creative.
to the student to make sure that they give their guests the information, because we do not have access to it.
So at this point, and before we move on to our kind of medical records, here are some conversation starters that you can have with your students this summer. So one, what are your communication expectations, right? How often are we going to be checking in with each other? This isn't just about grades or bills or health, just in general. You're used to seeing them every day or close to every day, and so setting up those boundaries and expectations are important. We often get calls in our residence life unit saying, I haven't heard from my student, please check on them. And we say, great, when's the last time you heard from them? And it's 5 p.m. and you said 9 a.m. That's probably not an emergency for us. But if the expectation is really that you're talking, every 4 hours, I'm being a little bit over dramatic here. But if that's the expectation and you've missed a deadline, then we do want you to reach out to us and let us know. But having those questions kind of talked about this summer. The second really goes to what access you are going to have for their bills. So whether that's setting up the OPUS Guest account where you can log in, or being on that secondary bill pay email so that you automatically get those emails, that's really important.
And the students do and can give their log-on and password to their parents, and then they have access to everything that the student has. And that's really okay, but not necessarily that you want everybody to be able to do that.
Exactly. The grades we talked about a little bit. Official grades will not post until the end of the term. So for winter, that's the end of December, right, when you have them home for winter break. So nice conversation starters, just before the new year begins. How'd it go? What'd you do? Let's take a look at your transcript. Emory does not have any official midterm reports or grades that will go out. So I know it's a long time to wait between August and December, but we're all waiting with you. So again, access to grades really won't be an issue until December or after the fact. So this goes back to question one, how often are we checking in with each other, and how am I going to get updates for you? When is it okay for me to call and check in on you, right? Morning, afternoon, text, phone call, instant messenger, whatever that is. But the mode of communication, I think, is pretty important too. And then this is the big one. When is it okay for me to call the school? Well, obviously, if you're really concerned about your student, we want you to call us, whether it's an academic concern, a financial concern, a medical, any of those things. But you know your students best, and so if they're kind of letting you know the full picture, or if you just have that kind of pit in your stomach that something's not going well. I don't know if you want to add in.
Well, and one of the good entries to notify us is through family@emory.edu, because I can act as the air traffic controller, and if it's an academic question, I can usually find out the answer for you, and we're not shuffling you around.
Right.
And so we try to do that, and also my phone number, which is on our family website, which is family.emory.edu. So hopefully that'll be helpful to you, and you won't be going place to place.
But that's a really good note too. You can see there are already 5 people on this panel talking about areas. We are not a one-stop shop university where one person's probably going to be able to answer all questions. So when you are concerned, we will do our very best to answer all those questions, but it might take a little bit of time just to address all of the units or things that you have questions about before we come back to. All right, so we are going to move on to some of our health questions, starting with HIPAA.
So HIPAA, as the same rules apply that if you go to your physician, your information is protected, and the same thing goes with your students. So of course, if they're in any danger to themselves or others, like we had said before, we're going to deal with that situation as it comes up, and the safety and wellness of your student is most important. But otherwise, the information is protected. However, in a lot of the emails that you're getting, there are to-dos that your student will get from student health. One is about the immunizations, which we'll talk about in a second, about the insurance waiver, and the third is the forms, one of which is the FERPA form, where they can allow contact with whomever they choose, parents, guardians, and other, to have access to their information. And we actively look at that. If something comes up, we know who we're allowed to speak with or not. We always err on the side of caution. We have lots of consent forms, and depending on the information, if it's a mental health concern, that's a separate category, and there's a separate form for that. But we're in this, actually a lot of times the student will say, can you speak to my parent, my mom? And we're very much open to that, or emails or phone calls. But of course, we're going to go back to the student and make sure that that's okay and what's exchanged with the parent or guardian. But a lot of it is, again, exactly what you would expect out of your own doctor's office.
Great.
Immunizations. This is a hot topic. I think we all know, based on the measles outbreaks. There's been several mumps outbreaks. And so this is very timely to discuss and very important. So we have definitely gotten much more proactive in our immunization requirements, and we wanted to make it also as easy as possible. I think most parents have been trained also by schools to be able to offer up and show what the immunization status is for their students already. So this is probably going to be old hat, but it's all about the process, and we want to make that process very easy. So if you do go to our website, we have a video that really walks you through the steps and shows you the clicks, because that's really how our brain works now, is where do I click, where do I upload, and it shows you that right on that website with the video. There is one thing that we added, is a tuberculosis questionnaire, which is very easy, but that's one thing for the parents to know, that if there are any answers that are yes, the TB screening should be done before they get to school, and it will walk you through what needs to be done. Next slide.
Sorry.
That's okay.
Okay.
There we go.
So again, these are very, very common and coordinated immunization requirements. The American College Health Association guidelines, as well as CDC guidelines, went into these requirements. So measles, mumps, rubella, again, you want us to have this in place based on what's been going on in many of the college communities with measles outbreaks and mumps outbreaks. So everybody needs to have 2 vaccines on record, or they have to have titers which provide or determine immunity. The tetanus and diphtheria, there actually has been pertussis outbreaks as well, which is whooping cough. So everyone has to have at least 1 Tdap, which includes pertussis, within the past 10 years, either a Tdap or a TD within the past 10 years, and at least 1 Tdap in their lifetime since their childhood immunizations, which they had that series of 5. The other thing is hepatitis B vaccination series. They need 3 vaccines, or the titer, to prove immunity. We did change that it should be a quantitative titer, since a lot of our students do volunteer in health organizations, and that's what they would require. So we wanted to make sure that that's already in place for them if they decide to do that. The last thing is varicella, which is otherwise known as chickenpox. We're not seeing a lot of chickenpox anymore. Actually, my medical students and residents have not seen chickenpox. but we did have one case on campus, so we have changed and we've gotten a little bit tighter in our requirements that they have to have at least 2 vaccinations and a titer as well. So we are, again, there's a lot of methodology and evidence as to why these are in place. And experience.
And the most important thing is we've given a July 1 deadline for all of these immunization reports. We know many of your students have received these vaccinations through life, so this shouldn't be a lot unless they need kind of a booster or a titer. Is that right?
Right. And
yeah, but July 1st is the deadline. If your students are traveling, if they haven't been able to get to the doctor before July 1 and you're really worried about them moving in, we really ask that this gets done before you come for orientation, so before August 24th. In the worst case scenario that you couldn't get those done, there'll be a number of immunization clinics throughout that orientation weekend and the first few weeks of classes. So this will not affect their fall registration, but if this is not done by October, it will affect their spring registration. And so really it's just best to get it done now so that you're in the clear, you know what's going on, we have all of your records. Great. All right, so here are all of the requirements too, which you can read them through. These have been communicated to your students through their summer checklist, so it's one of the items they have to do. And like Sharon said, everything on their website is kind of point and click, step by step. And so although it might look a little overwhelming on one slide, really when you go through the step by step, you should be pretty clear of what you need to do. Is there anything else you want about these requirements?
I think there's a couple on the next slide.
Okay. All right.
And this goes to what Sherry just spoke about, is if you don't get this done, there is a hold, but we really are trying to make this as, we're supporting you through this process. We're making sure that you have everything you need right now to access and upload, submit what you need to do. And again, it's so much easier if it gets done before you come. And from personal experience, as I'm also ushering a freshman into college next year, having them go to their physician, getting all the paperwork done, and then we're also going to talk about some of the recommended vaccines, and some of those you might not have gotten yet, and that's really important to make those doctor's appointments right now because they book up really fast.
Great.
So, and this is where this fits in. So their meningitis B is a series. It could be a series of 1 or 2 vaccination, or 2 or 3 rather vaccinations. So that's something that is very timely right now. The HPV vaccine as well. Most of students have gotten that already, or at least started. Flu shot, we'll be offering that in August and September, and hepatitis B. Again, most of the students have gone through this, and if they are not finished a series, we will finish the series for you, so don't think that there's a timeline that you have to get it done before that. If it's started, we can continue it. We have all these available. We have a very robust immunization offering in our office.
That's great. All right, this is a little bit different. So if students have chronic health conditions or need accommodations, this is a big change, I think, from high school too. So when we're talking about chronic health conditions, Crohn's disease, migraines, allergies are some of the chronic health things I'm thinking about. Also includes mental health issues, depression and anxiety, especially if students have had official diagnoses. And then also learning challenges too, which we'll talk about a little bit more later in the summer. But for all of these, students really need to officially register with our Office of Accessibility Services. And I'll make an important point for this, even if you haven't had a flare-up for something in years, like a migraine or Crohn's, or you think that medication is all set and we're good to go, it is still worth talking to the Office of Accessibility Services, submitting all of your paperwork to get registered just to see what accommodations might be appropriate for your student. We're moving into a new environment. There are new stressors. There are new interactions with people. You just don't know, in Georgia alone, allergens are insane. So people who have never had allergies might get them down here as well. But making sure that they're connected with that Office of Accessibility Services, getting all of their previous documentation in so that our office can assess what an appropriate accommodation would be. This is really different than in the past where parents would have rights to do it. With OAS, it is all student activated, and students have the responsibility to turn in their forms at least to get accommodations with their faculty members every single semester. So even if they're registered with that OAS office, accommodations aren't active until they get their letters each semester, and that's a big change too. So if this is of concern to you, there will be a lot more information on the OAS website of how to register, and with that process, also very easy, step-by-step. It tells you what to do. But for chronic health conditions, are there things that you think that students should be doing now? Maybe transferring prescriptions, and I'll let you go.
Well, transition of care is a really important buzz topic right now. I actually went to a conference and we talked about really making sure that your student knows how to access everything that they will need and be proactive, not meet us in crisis. That's the worst scenario that we deal with, is somebody's in crisis and we have to backtrack and figure out what's going on. We want this to be a situation where we have their old records, they have all the things, all the labs and everything they need for us to act on. We know who to especially if they have a student health insurance, they have to meet with us for our referrals to the appropriate specialists. So really front-loading that at the beginning of the semester before things get too crazy. But again, making sure they have all their information for their insurance, have old records, or at least the contact information from their specialist so we can get the records we need to give them the care. The same thing with the psychiatrist. We do have 4 psychiatrists in student health. And the other thing, it is a big part of that process is making sure that they have their psychiatrists, psychologists put in place, especially before the stressors really hit, and they have their support team, their safety network in place. So making sure they have, especially insurance, is a really important thing to empower them with.
I would say transition of medication is also really, really important. I know most medications might give you a 3-month supply. Obviously, the fall semester is longer than 3 months. And I can't tell you how many students come into us going, I forgot, I ran out of my medication, I've been without for 2-3 days, and then it's an emergency. So these are other questions too you can start having with your students. Need medication, when are you going to alert me for your refills? Do we need to transfer your prescription to a local pharmacy? Things like that are good to talk about now.
And Sharon, we might know there's like 2 CVS stores close by, and can they go through Emory Clinic to get any prescriptions, or through your clinic?
So we do have some, but it's more point of care, cold, cough medications in house. But the Emory Hospital does have a very robust pharmacy, as you would expect, and we are flanked by 2 CVS. Again, I recommend, especially in a chronic care situation, that you meet with one of the providers. You can access the portal, which will give you all the different names and times and accessibility that they will need. So really early in the semester, making sure that they have that appointment in place, and then getting everything transferred as far as pharmacy and specialist referrals can be all done at that same time.
Right. Now, we don't have a slide about this, but I know that a few questions have come up about the insurance process. So if you'll walk us through that before we turn over to our final questions you can ask your students.
Absolutely. So insurance, I know for all of us, is relatively complicated. So imagine for your student how it will be. So we want to make sure that this is as easy as possible also. It is the insurance waiver, which pops up on OPUS. If you click on the health tile, it'll pop up. It is an opt-out process. So if you're going to be enrolled in the Emory University Student Health Insurance, otherwise known as USHIP, we're very big in acronyms here, they will automatically be enrolled unless you sign the waiver and upload all the information about your insurance. The waiver has 12 bullet points of what we recommend and require as meeting the requirements for insurance, and that is open now. That waiver site did open. So again, it's going to OPUS, filling out the waiver criteria, uploading your information for your own insurance, making sure that we have it in our system and your student has the card, so when they do come here we can cross-check and cross-match all of that.
Yeah, I would say getting your students a copy of their own insurance card is huge, and really talking through how to make doctor's appointments. We're going to cover this a little bit in our first few weeks of our PACE class, but if they've never made their own doctor's appointment before, a lot of times they'll end up just going to the emergency room. That's probably not the best case scenario, and can be very, very expensive. So kind of talking through those situations and starting with our student health, because all visits to student health, whether they're on Emory insurance or not, are free. Where the extra costs may come in is with medications or follow-up exams or tests that they would have to run that are then run through your insurance. And so that's where the differing prices, I hope I'm saying that correctly.
That's
Yeah.
And the
we'll
other
through.
caveat, right now we do contract with about 42 PPOs, so we do take and we process bills for those insurances. Right now we're not accepting Blue Cross Blue Shield, so how that works is we see the student for free, but any in-house test, throat culture, and our prices are very reasonable compared to the outside world, is fee for service. However, we as an Emory healthcare do take Blue Cross Blue Shield. So if we have to get them to an x-ray or to labs or specialists, they do take Blue Cross Blue Shield. So I know that you're probably seeing the caveat that we don't take Blue Cross Blue Shield, but we do manage that, and just as the executive director, we're working on that actively because we know how that can impact so many people right now. So more to come on that, but I wanted to just explain that caveat. But yes, the visits are free, but any labs, x-rays will be processed through your insurance, and depending on your own insurance coverage, which I think is one of the important points, is your students need to know about deductibles. They need to know we don't take co-pays because the visit's free, but what the co-insurance is. For example, if somebody says, well, that first visit to the specialist was $300, it might have been because the deductible wasn't used yet, so the next visits won't be as expensive. So, my staff is tremendous at answering questions. We'll sit down and go over everything with students as well. So please know that you have a lot of resources to walk them through.
Yeah.
When is the waiver good through? How long can they do the waiver?
Thank you. The waiver ends on the first day of school.
There's a quick question just about where families can find information about the Emory Aetna plan, including what medications are covered. So is there more detail that probably on your website?
Yes, so the website, you can look at Emory. If you look at our website, there's an insurance tile that you can click on, and then there's the Aetna Student Health link that goes through our program, our plan brochure. As far as the insurance coverage for medications, we're actually discussing with Aetna what that's going to look like, so stay tuned for that link as well.
Okay. So a few more just follow-up questions kind of to wrap up what we've just been talking about. One, making sure you're reviewing your insurance card, that your student, if your student's staying on your insurance plan, that they have their own card to bring with them. That's super important, and that they carry it with them.
Or
a copy of
or a
it,
picture
exactly.
Of it is fine.
Yeah, and plan that they understand what that coverage is. So kind of basic level conversations about co-pays, co-insurance, and such. Again, if you have to transfer any medications, whether or not you want to do that, there are 2 CVS locations in walking distance. One is in our Emory Village, the other is called Emory Point. So if you found Emory on either of them, you should be in pretty good shape. Also, what will your plan be if you're not feeling well? Your students are probably going to get a cold, potentially the flu. They're living in tight quarters with other contagious students. So think back to kindergarten, right? And washing our hands and all that good stuff. But, what are they going to do? What's the threshold for when they go to the doctor? We are surprised actually about how few students have, never made their own appointments before. And so they're going to be responsible for that. We will teach them how to make appointments in their student portal. But sometimes we teach them too early or even too late. So just kind of having them bookmark the student health website is a really good idea.
And adding to what Sherry said, when your child gets ill, and I've had a child in college, it is emotional because we are the ones who love them unconditionally. So if you have a plan beforehand, then when they do get ill, they can still call or text you for your unconditional love. However, then they can say, I'm going to go to student health, or I've made an appointment with student health. This is what I'm going to do. So try to do that. That's another summer conversation to have, so that it doesn't get emotional when they do call not feeling well.
Right. And we know that medical conditions can affect academics. So we're going to be teaching your students, one, how to advocate for themselves and to let people know, right, if they're missing class because they're sick or something's going on, they should always be in touch with their faculty members. If it becomes something more serious, more than 3 or 4 days, our office, the Office for Undergraduate Education, will really step into. So those are not details you need to know now. We're going to be sharing those with your students come the fall. But we do have processes in place to help them get through. But the key is communication, right? If they are not feeling well, at least letting their roommates know, letting the resident advisor on the floor know, because we have this great community of care, but we can't care if we don't know. So, kind of like see something, say something, making sure that people are sharing that information so that if it does escalate to something more serious, we can swoop in a little bit quicker.
We do, just as an aside, we do have Saturday morning hours during the semester. It's 10 to 1. It's for urgent care. And just to let you know, from our perspective, if somebody's really not doing well and sick, we have a van and we'll take them back to their dorm, or if they need to get a prescription, they're really not feeling well, they have the flu or something like that, we'll get them through our student intervention team, a ride over to CVS. So it is a big campus, but we are very, very much aware that they're taking care of themselves, and we want to help them get through the illness. So accessibility is really important. The portal's available 24/7. You would be amazed how many people make appointments at 3 o'clock in the morning. We open at 8, we're closed at 5:30. We're open on Saturday. We have 24/7 coverage for medical questions. We always have physician backup for that. So they're not out there by themselves, and just knowing how to access it is really important.
Right. All right, well, we're coming to the end of our time. We've actually gone a little bit over, but thanks for sticking with us. We have 2 more parent and family webinars this summer on July 10th and August 1st. So the next one is supporting your student through the registration process, which we know is very big on their minds. So Bridget and I will be hosting that with some of our advising friends in the advising office. And then our final webinar on August 1st is preparing for orientation. So we'll have representatives from both the orientation team and our housing and res life teams to answer all of your questions before you come to campus. But we really appreciate you taking the time to be with us today. And we are so excited to welcome you and your students to Emory in the fall. Have a good afternoon.
Great, thank you.
Thank you.
Oh, there are a few more questions? Okay, so Blaze is our producer and director, and he says we have a few more questions, so we'll take a few more of those.
We have the first one being just a little bit more clarification on Blue Cross Blue Shield. Emory does not cover, or how that billing works if they do have Blue Cross Blue Shield and what that looks like.
So the question is about, again, Blue Cross Blue Shield and how that covers or doesn't cover.
So for Blue Cross Blue Shield, the student health does not bill Blue Cross Blue Shield. So any charges are fee for service paid at the time of the visit, and that's really just for in-house urine tests, throat cultures, things like that. If anything needs to be sent out to a lab or an x-ray, that's actually through Emory Healthcare, and they do take Blue Cross Blue Shield. So that will be billed as your Blue Cross Blue Shield would be done at home. So it really is that small window that we don't cover. The visit's free, there's no copay. It's just if anything's done in the office, it would be a fee for service and paid at the time of the visit or put on their bill.
Do you know if the Emory Points CVS actually has a minute clinic as well? Do they take Blue Cross Blue Shield? Not sure.
Probably, but I don't know.
Okay, so that might be another option too if it's just you pay for the visit, right? You have the copay, but.
So my thought is the throat culture, I think the throat test, the strep test is about $30. So by the time you pay copays
and the rest,
and this way we get to shuttle them through.
Perfect.
There is somewhat of a balance for things like that. You know, for other costs, obviously, we have these conversations with students and we support them through it all the time. So.
I think that's the takeaway is if students know what their plans are and then are willing to ask the questions of the doctor or the nurse practitioner while they're in the office, they're going to coach them through what the best options will be. So they don't have to make those decisions totally blind or on their own.
Right, exactly.
Great.
We also have this one about medical power of attorney, and if that needs to be sent to the school, what that looks like.
Medical power of attorney.
Sometimes it's up to us, and we put it in our we scan it into our EHR or health record.
Okay. So yes, you can send that medical power of attorney in when you're uploading the immunization forms probably, and that'll just be part of the student's record. Great.
Any vaccine form that requires a housing assignment, is it okay to send that without that until a housing assignment comes until July, or what does that look like for y'all?
So that form is actually separate from us. You can, let's see, I'm trying to read it right now.
Or can they just put Emory University?
Yes, you can send it in without the housing assignment.
Okay, so-
now that I read it.
Yes. We know they're living on campus,
Yes.
so that's good.
Back to an OPUS Guest Access question. If they're already an Emory employee and they already have an OPUS account, they need a separate guest account.
Yes,
Yes.
the
Right.
OPUS account is for the student, even though the parent may have an account. It's the student's OPUS account, and it's not the an employee's account.
Great question.
Right.
That could be everything.
Okay. Well, again, thank you so much for joining us, and we look forward to seeing you in just a few months.
Good luck.
Thank
Bye.
you.
Thank you.
Bye.